Mid-Florida chapter. Thank you, Miss Jaleesa. We are glad to have you all with us. And of course, this month we are celebrating Women's History Month. And so women have made great contributions to our communities and to our country and to the world. And so this is the month that we recognize and emphasize those particular contributions. This year's theme for Women's Histories is around women, women's health and our contribution as caregivers. And so we will introduce here shortly our special speaker for the day. We are so excited to have her with us and to have her availability. I know she's very busy, so we don't want to prolong and hold her any longer than we have to in today, because you'll see very shortly that she has a major role that she plays in the wellness of women and the wellness of men as well. And when we talk about things along the line of breast cancer, et cetera. So I'm Ralphette Aker. For those of you who may not know me, I currently serve as a vice president. And we will have joining me shortly, Miss Berenice. Berenice, I never can get the last name right, so I apologize in advance. Belizzari, did I do that close to right? She's saying maybe. And talk about where we are as an organization and how it is that we're going to move forward. I do want to say we are still asking and seeking members for our various community and committees within the organization. Our finance committee is always looking for new and willing persons who are have a desire to work in the finance and with our budgets. Our program and community outreach and community service group, I have the privilege of chairing, but have a wonderful committee that does the yeoman's part of the work. Jaleesa Harris, Berenice, and Yolanda Triplett are the persons who are currently serving as a part of that committee. We have another young lady who will be joining us from UCF. Our membership committee, Miss Shavala McFarland and Shavala McFarlane, and Shavala, the group is here, and I'm sure she may have some comments on membership and how we can better serve our members, and I'll ask her to speak in just a moment. Communications Committee, Carol Clark. Carol, I saw the Facebook post yesterday, so I'm not sure who on your committee was responsible for that, but thank you all so much. It was wonderful to log into Facebook and see a Mid-Florida presence there, and to be able to share that out with more of our friends, my friends individually, as I hope you all will begin to do. If you are on Facebook, please friend. Carol, do you want to kind of give us that address for the Facebook page, etc.?
Yeah, we'll put it in the chat. Good morning, everybody, or afternoon, I should say. Glad to see that you noticed. Danielle is heading up that portion for us, and she did a phenomenal job in putting our message out. And we've got some timed messages that will go out. And so we've got a little strategic plan going here for our social media. We've been tackling this piece by piece, and it's working out. So I'm proud of Lori, Jaleesa, and now Danielle, who contributes to our committee, and we've done an excellent job. I'm going to pat us on the back because we came up from ashes.
Well, I will pat you all on the back. I think you all have done a phenomenal job in getting that information out in various ways through the use of Constant Contact and now Facebook. Like I said, I opened it and that popped up on my screen and I thought, wow, isn't this awesome to be able to see that. So Danielle, Jaleesa, Lori, Carol, I think I got everybody in there. Thank you all so much for your work with that group. I'll drop back real quickly to Shavela. Did you have some membership information you wanted to share?
Good afternoon, everyone.
Hello.
Okay, I'm like you, I was making sure my technology was working accurately. So currently we have 31 active members in our chapter, and the National Membership Committee has decided that they were going to hold off on doing another round of phone-a-thon for membership drive. So at this time, there's nothing that's happening on the national level. I did share with Ralphetta and also Miss Johnson, Bell Johnson, membership opportunity that we have to sponsor an event here in Orlando. Did you want me to speak on that or just?
Yes, please, because I saw it and I took a very quick look at it, but if you would go ahead and kind of share that, that would be wonderful.
Okay, so I've been a 22-year member of an organization for International Masons and Order of the Eastern Star. And each year they have a annual conference here in Orlando. So this year is the 69th annual convention. And it's a organization predominantly made up of Black administrators, business type people. And so I sent in a request for a sponsorship from our chapter so that I could collaborate between the two and bridge the gap. So we have probably about 600 plus people. I would say out of that 600, it'll be 500 people that are from, the Florida area, and an opportunity for us to let people know who we are, what we do, as well as membership drives. So I was talking about having some of the information we have, any kind of flyers, so that we could insert those into the convention bags, any kind of signage, things of that nature. Okay. And so that's the high level view of what the request was.
Okay. I will say, Shavela, what we probably need to do is you and I and Carla, the executive team, and we did not have our executive committee meeting this month, is to get with Carol and her team and just see. I don't think at this point we really have any of that collateral material. But to see if there's something that we could maybe at least create that might be a one sheet insert into some of the conference material, but we'll have that conversation. I'll try and get something scheduled for the first of next week for us to have that conversation. And I'll get with Carla upon her return and see if we can facilitate that happening sooner than later. Okay. But 31 members, we are always open and welcoming to new members, persons who are interested in joining NFBPA and particularly joining with us in the Mid-Florida chapter. You'll see here in just a moment, we're going to ask a couple of critical questions for us as we go forward to determine when and how and where we meet. We've been meeting for the last almost, 2 years now via Zoom and electronically at lunchtime, and whether or not that's going to be the desire of the group going forward or some type of hybrid type of meeting components. The University and College Relations Committee, Jaleesa has and is chairing that. So Jaleesa, I don't know if there's any new updated information from that group.
I do not have any updates. Thank you.
All right. Thank you. And so Forum 2022 is occurring at the end of this month, the 30th of March through the 3rd of April in Grand Rapids, Michigan. At our last meeting, I asked if there were any who were planning to attend. I don't know, Norton, if you are planning, Mr. Bonaparte, if you're planning to attend. I know Mr. Brooks is planning to attend, And several of us have gone back and forth on whether or not, and I think we've all kind of landed on the no, in the no category. I saw Mr. Bonaparte unmuted. Yes, sir.
I'm in the no category this time, although this will be the first time I've missed the form for a number of years, but I am a no.
Okay, all right. So it sounds like we will have a limited number of representatives in the House at the end of the month. And unfortunately, I think a lot of us were caught in some of the, were unsure as to where the variants for COVID were landing and had some apprehension about a fully in-person conference and being able to be in rooms with, 2, 3, 4, 500 people that you weren't sure of their status. So if there are those that are going, if you can, place in the chat that maybe you're planning to attend, we'd like to be able to follow up with you on the different types of information or different types of resources that also may be available during that time. And with that, I will turn to Bernice and we will talk about the poll. And I'm going to look to you to introduce that.
Good afternoon, everyone. So if you could, you can type in this URL into any search engine. I can also include one I think you can do via text if that's easier. I'll put in the chat as well. And this is just to gauge everyone's preference for future general board meetings. And I will also enter the texting option in the chat right now.
So
And
we
I know
need to put in our URL. I'm trying to get there.
Yes, and the URL is currently in the chat box, so you can just copy and paste from there. And Berenice, if you'd like to activate the poll.
yes, it should be open right now. And if you wanted to text, the option is also in the chat.
It's still showing me that it's waiting for your presentation to begin.
Okay, let me try again. Is it working
Okay.
now?
We're all set.
So I put my name in and then I can vote, correct? Yeah, it says it's waiting for your presentation to begin.
Still? That's odd.
If you refresh it, that's what
Oh.
worked for me. So
Is it still working now?
It's letting me vote.
Okay, good.
I guess. Now, how do I know that it's? Okay. It let me click on, is it, how many questions do we have, Berenice? Just
It's
the
just
one
the
question?
one, yeah.
Okay.
And Berenice, once that's finished, if you could take a screenshot of the results and I will get that from you.
Yep, gotcha.
I know that Poll EV sometimes clears it out, so
Yeah.
be sure to take it right after.
Yeah.
Yes, for anyone who's having trouble with the poll, if you refresh the link, it should allow you to submit your response and Berenice will collect those.
You should have a response, I hope.
Yeah, I have a response here.
Okay. Perfect.
So we'll give that just one more minute and then
Yes.
we'll move to our speaker.
We've got one more quick item of business. And Lorenzo, while folks are taking the poll and finishing up, do you want to go through the list of officers for 2022, 2023?
Yeah, it'll be my pleasure. Let's see. Thank you for this opportunity to provide a report from the nomination committee. The nomination committee followed the protocol as is directed by the bylaws. We conducted an assessment to get a recommendation of nominees. We presented a ballot, and that ballot was distributed to the official members as is recorded by the national organization as being financial at that current time. And I'm happy to report that the nominations were closed. The ballot has been presented. The votes were counted, and I will now present the results of that the polling results as were documented by official polling site. It's my pleasure to note that the voting members that participated did provide a result for Michelle Patton. Michael, is that Michelle? Our treasurer, the position for parliamentarian was Michelle Patton. And I'm happy to report that she received 100% of the vote. So the parliamentarian-elect is Michelle Patton. The historian position, we had a nomination of LaVon Williams, and I'm happy to report that LaVon received 100% of the vote. So LaVon is a historian-elect. For secretary, Jaleesa was nominated, Jaleesa Harris, and Jaleesa, that position received 100% of the vote. For treasurer, we have Shavela McFarlane. Treasurer position candidate received 100% of the vote. And for vice president, we had on the ballot Yolanda Triplett, and the members voting did provide a poll tabulating that Yolanda Triplett received 100% of the vote. And then for our president, we had Ralphetta Aker. And I'm happy to report that the members have elected Ralphetta Aker. She received 100% of the vote for the ballots received. So our slate of officers were very proud of the people that had decided to lend their service to public service and also serve this organization. And it was a unique opportunity that all of the people on the ballot received 100% of the vote. So that says quite a bit for the resiliency and the testament and the attitude that our voters had for the slate of officers. So I'm happy to note that those officers that were on the ballot, all of them received 100% of the vote. And unfortunately, one of the electorates could not be here today, the participants. And a note was made in the chat from our historian. And if you'll check that out, I think a comment was made. We provided these results to the candidates earlier, and we're happy to report that all of the people on the ballot received 100% of the vote. Are there any questions about the process or the results? Hearing none, I'll close my report.
Well, first of all, let me say thank you to Lorenzo and his team who worked to put together the slate of officers and then who stuck with this process through some technology challenges and made it a reality. And so Lorenzo, as the immediate past president of the chapter and who has worked and stayed diligent through a national conference and a pandemic and all of these wonderful transition times that we've gone through. Thank you very much for your continued support of this chapter and of NFBPA. We greatly appreciate your and your team's work. And then secondly, let me say thank you to those who voted for your vote of, I won't say confidence, but your vote of support in this process, because this will surely be a team effort as we move forward into 2022 and the start of 2023. And as we try to transition into what is now our new realities of how we live, how we meet, and how we work together for the betterment of the community and our organization. So thank you all so much for all of your work, for all of your commitment to this chapter and to our national organization. And with that, we'll come back to the poll after we have heard from our speaker, and I will look to Ms. Jaleesa to introduce our speaker, our lady of the hour, and turn it over to the two of you.
Great. Thank you so much, Ralphetta. I am so excited to have Dr. Danielle Henry as our speaker today. As Mid-Florida NFBPA celebrates and recognizes Women History Month, this year's topic is, well, this year's theme is about promoting healing and hope in the contributions women have made in the area of caregiving. And if we'd like to spotlight Danielle, and I will pin her for you guys. And just to give a quick preview of her background, Rafetta, if you'd like to advance to the next slide. The other way. Great, thank you so much. So Dr. Henry is a board certified general surgeon and fellowship trained breast surgical oncologist with the Breast Care Center at Orlando Health Cancer Institute. She earned her medical degree from Florida State University College of Medicine, but she also went to University of Florida, so go Gators, which is how I met her. She completed a general surgery internship and residency at Orlando Health, where she served as administrative chief resident and won Best Resident Award. She went on to complete a Society of Surgical Oncology Breast Surgical Oncology Fellowship at the Moffitt Center and Research Institute in Tampa. And while at the Moffitt Center, Dr. Henry received the Junior Scientist Partnership Award for collaboration with the Immunology Lab to investigate local immunity within breast cancer tissue. Her clinical interests include high-risk breast cancer groups like genetic carriers and minorities, and we are so glad to have her. And I believe her husband is online as well, as he also serves in public administration. So we're glad to have you. And Danielle, if you'd like to take it away.
All right, perfect. Good afternoon, everyone. Thank you so much for the opportunity to speak to you all today. Let's see. I'm going to share my screen here. Give me a second, I'll get that pulled up. All righty, so thank you for that wonderful introduction, which is a great segue into the presentation today. So it is Women's History Month, and I'm really honored for the opportunity just to have a little bit of time to talk with everyone here today about a little bit about what I do and my passion. So a lot of times when I tell people that I'm a surgeon, their first question is, what is it like? So I'm going to talk to you a little bit about what it's like and what drives me. So for starters, and Jaleesa gave us a really good introduction to that, is that it required a lot of graduations. So I went to the University of Florida for 4 years and got my bachelor's degree there. And then I went on to medical school, which was another 4 years at Florida State's College of Medicine. And then after that, I spent 6 years in general surgery residency at Orlando Health here in Central Florida. And then following that, I went on for an additional year to specialize in breast surgical oncology at Moffitt Cancer Center in Tampa, Florida. So that is quite a few years of post-high school education and training, but I wouldn't change it for anything. So as all of that is happening, I became part of a changing landscape. So in 2017, for the first time, the number of women enrolling in medical school exceeded men. So this happened a little bit after my graduation, but like I said, this landscape is changing as women are going into medicine more than men. And also in 2017, we saw the number of women going into general surgery also went up. So it was 17% in 2013, and it went up to 20% in 2017. I'm sorry, in 2013, and then went up to 20% in 2017. And then even though I graduated residency in the 2000s, I was the second African-American female to graduate from my general surgery residency. So a lot of changes happening over these years. And so all of that to say is that ultimately I became and am a breast surgical oncologist. So I take care of ladies that have breast cancer and also ladies that have any issues related to the breast. So what is that like? Well, it is a privilege to be able to work with women in a very difficult and very intimate time of their life. It's very humbling as well as they choose me to help them at this time. That can be very difficult as well. But it's very rewarding because breast cancer is very treatable and curable. And that's the thing that really drives me to continue to do what I do, because I know that I can help so many women. And then one of the themes about Women's History Month this year is, what is it like during a pandemic? So this definitely brought us into uncharted territory as a nation, especially in healthcare. For me personally, as an essential worker, working from home wasn't an option. So it really put us in a position where we felt very vulnerable, but we had a job that needed to be done. So as a wife, it was very worrisome. Am I going to potentially bring COVID home to my husband? And then coincidentally, I've had 2 pregnancies through this pandemic. And so being at a slightly increased risk to the virus, having to not only worry about myself and my family, but also my unborn child, made it an especially difficult time. But thankful to say that so far everybody is doing well and is very healthy. So breast cancer, I'd be remiss if I gave this presentation and didn't talk a little bit about my passion of breast cancer. So breast cancer is the most common cancer in American women. 1 in 8 women will be diagnosed with breast cancer in their lifetime, and that risk is higher in the later years. So we see breast cancer most often in women in their 60s and older, and it is the 2nd most common cause of death from cancer. To bring it a little closer to home, Florida has the 2nd highest number of new cases and deaths in the United States. So even though we're the 3rd most populous state in the nation, we have the 2nd highest number of new cases and deaths in the United States. So awareness about breast cancer in Florida is especially important. Now, for some reason, our graphics are not showing up here, and I apologize for that. I'm not quite sure what happened here. Let me see if I can fix that. All right, it doesn't look like it's going to come up here. In the interest of time, I'll continue to talk. However, what the pictures illustrate is that over time, even though the incidence of breast cancer, so the amount of women who have developed breast cancer has gone up over time, the amount of women that are dying from breast cancer is going down. And we're seeing that in all ethnic groups, which is really good, meaning that we're making advancements in the treatment of breast cancer. So we have better imaging that allows us to detect breast cancer early. We have better surgeries that are able to treat the cancer, and we have better medications that are also able to treat the cancer. So one of the things that I'm especially passionate about is breast cancer in the African American community, in Black women. And so Black women are actually less likely to develop breast cancer compared to white women and non-Hispanic women. However, more women will die from the disease. And so this is one of the things that I'm hoping in my lifetime that we can see that change, that we can see an equal playing field for Black women when it comes to how they fare after being diagnosed with breast cancer. So why is that the case? And I think that it's definitely multifactorial. So there's many things that go into the development of breast cancer, and there's many things that can make it difficult for someone to deal with the diagnosis and to have it treated. So definitely we understand that there's a lot of mistrust in the medical community, which may make it difficult for someone to seek care or they may not get the compassionate, appropriate care that they need. And I'm hopeful that as a Black woman, that women would be able to see me and feel more comfortable and being able to open up that avenue and to break down those barriers for women who are dealing with problems related to their breast. But the other thing is that it can be financial. So it's hard to take time off of work to go and get your medical care done. It could be that we spend a lot of time as the kind of head of our household or taking care of everyone else, that we kind of put our needs and our health on the back burner. And then sometimes it can just be fear. And, this is not something specific to Black women in general, but overall, when something's wrong, sometimes we can be scared to seek care. And then there are some things that we really have no control over that make breast cancer diagnosis a little bit more difficult for Black women. So there are some things that a woman may be born with that make them at an elevated risk for breast cancer. And the BRCA or BRCA gene is one of the things that we have seen in the Black community. This is something that can be passed down in families, and it can be associated with a more aggressive form of breast cancer. So this is one of the reasons why it's really important to talk with your family about your history, your medical history, and finding out if there was anyone in the family that had breast cancer, ovarian cancer, prostate, pancreatic cancers, any type of cancers, because these may be clues into something that's running in the family. And if we can diagnose this early, then we can sometimes even prevent breast cancer from beginning. So I know a lot of times we can be very private about our medical problems in history, but this is one reason to share, because it can do a lot of good for the entire family. But coming back to kind of one of the earlier slides, I don't want it to be all doom and gloom. Like I said earlier, is that one of the things that motivates me the most is the fact that I know that breast cancer is very treatable and it's very curable. And one of the things that I had illustrated in the pictures that unfortunately are not coming up here today is that the survival for breast cancer for Black women has improved over time. And with that being said, I hope it continues to improve, and that the numbers between the amount of women that are Black that survive and those that are not come closer and closer. And so there's a quote from Michelle Obama that she talks about about voting, but I think it's a really good quote that kind of applies to many things. It says, women, Black women especially, we have voices. And when we use our voices, people listen. And when we do it together, there's no telling what we can accomplish. And so really, I think that with all of the information that we learned here today, if we take this information and spread it amongst our friends and family, that we can accomplish so much with just a little bit. So I don't want to spend too much time talking about all the nuances about breast cancer, but I did want to kind of make a couple of highlights regarding breast cancer and kind of tell you a little bit about what I do and how I got here. And now I'm happy to take any questions anyone may have.
I actually do have a question. First, Danielle, thank you so much for presenting. I really appreciate it.
Absolutely.
And I was really excited. I was like, oh, this is the perfect one to ask her. So I've seen that some information that breast cancer risk is something to be assessed at younger ages than before. I think typically they recommended that if you're over 40, that's when you should start really looking for breast cancer and doing those screenings. Now I've heard that they recommend it for even younger people. So at what age do you typically recommend people to start that screening process?
That's a great question. So I recommend that women start getting their screenings done at 40 years old. So at 40, women should have a mammogram every year. So there are some There are some organizations that say that you can have a mammogram every other year, but the American Cancer Society, the American College of Surgeons, the American Society for Breast Surgeons, all of those societies recommend that women should have a mammogram every year. So you should really push to have that done every year. Now, a woman can have a baseline mammogram at 35, just to see if they're having any issues with their breasts at that time. And then they can resume having mammograms yearly at age 40. Now, if there is some type of history in your family, then you would want to start screening earlier. So the recommendation is that you start 10 years earlier than your youngest diagnosed family member. So if you have anyone in your family that was diagnosed with breast cancer, say they were diagnosed at 40, then you would want to start your screening at age 30.
Great, thank you.
Absolutely.
Dr. Henry, what does it mean when they say you have dense tissue?
That's a really good question. So dense breasts, so our breasts are made up of 3 primary components: fat, ducts, and lobules. Without getting too technical, basically, the ducts and lobules are the part of the breast that make milk. Younger women have a lot of those parts of their breast when they're in their childbearing years. Those parts of the breast show up very cloudy on the mammogram. And so more cloudy a mammogram is, it's kind of more dense. And so it's very common for young women to have dense breast tissue. So that's why we don't really like doing mammograms in 20-year-olds, because their breasts are very dense, because it's made up of mostly the parts that make milk. As we get older, the parts that make milk get smaller and smaller, and the fat gets larger and larger. It has nothing really to do with weight gain or anything like that. It's just that we don't need those parts anymore, so they shrink, and then the breast becomes primarily composed of fatty tissue, which makes it very easy to see changes on mammography. So we do know that dense breast tissue is a little bit more difficult to see through on mammography, and it is associated with a higher risk for breast cancer. How that risk plays in is a little bit hard to determine. We haven't quite figured out if there's anything different that we need to do at this point in time, but those are some of the things related to having dense breast tissue, meaning that it's a little bit more cloudy on your mammogram, and depending on what the quality of your mammogram looks like, you may need to have an ultrasound each year when you go for your mammogram.
Thank you.
So I do want to make this a little bit more relevant to the greater body. NFBPA represents public administrators and those who support local government. And we know that in these types of roles, we do have a wide, majority or a large percentage are men. So how do you bring this conversation and make it relevant to men, that may not be at the forefront of their considerations? And then especially when we're thinking about promoting it and promoting programs within our local governments that support this type of education and activism around breast awareness.
All right, great point. So one is breast cancer does affect men as well. And so it's important that they have self-awareness of their body and that they check their chest wall. Men have a little bit of breast tissue there. So if they felt anything that was abnormal, they would want to seek medical attention for that as well. And I'm pretty sure every man has a mom or a sister or aunt or a cousin or whatever it may be. And so, I think the more people that are educated about breast cancer, the more that people can be aware of what they can do. So I think that it's primarily a women's disease. It does affect men, but I think the biggest thing is education. I mean, I think that everybody that understands kind of what is going on will be able to help. Someone may say something very casually like, oh, breast cancer doesn't affect men. And then you'd be like, actually, that's not true. It does affect men. And then, the government does have some programs for breast cancer screening and cervical cancer screening through the health department that'll allow women to have breast imaging and breast biopsies done on a sliding scale through the health department. So that's very helpful as well. You know, October is Breast Cancer Awareness Month. It's always a good time to remind people about breast cancer and to have them get their screenings done if they haven't already.
And I was going to say, I know for Orange County, and I was going to ask you about the mobile mammograms. We have a very very good mobile mammogram program that we offer for our employees. But I've heard some grumblings in the last few years that maybe the mobile mammogram is not the most effective means by which to be able to detect breast cancer and the need for further follow-up. So is that a good initial screening?
So it just depends on the technology that they're using in the mobile mammogram unit. Mammography, any type of mammography is better than none at all. And so if a mobile unit is going to be the method in which a woman gets a screening mammogram, then I'm all for it. You know, mammography has been around since the 70s, and it only continues to get better. Now, you know, the cream of the crop mammography is 3D mammography. And so that really has improved our ability to detect changes in the breast, and it has decreased the amount of times that a lady has to have an ultrasound or come back for additional pictures. But my thing is, get your mammogram every year. And I think some of the mobile units do have 3D mammography as well. And I think it's a great thing to make it convenient for people to get a screening mammogram by bringing it to the job. So that's really a great resource that I would encourage everyone to take advantage of, and that they continue to do that.
Wonderful. Any other questions?
I just have a quick,
So-
I have a quick comment. I agree with you, whoever made the comment, that perhaps men may not be interested, but as you're right, every man is passionate about his wife, his mom, his sister, daughter, cousin, you know, all these females. So I just reflecting on a very close friend of mine who passed away as a result of this situation. One of the first Black female vice presidents of a prominent financial institution, also the first chief financial officer of a financial institution, prominent business leader, just a trailblazer. And it was just saddened to hear that she passed away as a result of the situation that we're discussing today. So this does you know, run very close to the concern for men. A prominent person, we started many organizations together, the Black Business Investment Fund, several things, but I just was so shocked when they told me of the reason that she passed. It was mentioned earlier, and I just want to confirm, you're saying that this disease is curable. I remember when we had the forum in Tampa, we had visits from the Moffitt Cancer Center and talked to the professor of the school, that school there in Tampa, who was over the School of Nursing. And but the bottom line is, men are concerned because we are passionate about those people that it does affect. What can our organization do here locally to further the? This is inspiring today to hear of your participation in this. So how can we support you in getting the information out? What can we do to continue to help educate and bring this concern to the forefront?
Sure. So 3 things. One comment that I wanted to make was that, back to the mammography, you know, no matter what type of mammography that you get, try to get it every year. If you can go to the same facility every year, that helps increase the sensitivity of your mammography. And if you can't go to the same facility, just make sure that you have the images from your prior mammograms so that they can compare them. And that really helps a lot in making sure that they make the right diagnosis on your mammograms. 2 is that breast cancer affects women of all ethnicities, all socioeconomic statuses, all education levels. So this is not just, you know, one of the things that really kind of like grinds my gears is that sometimes they make it seem like, oh, well, you know, this person didn't have insurance, they weren't very educated, and that's why they succumbed to the disease. No, it really, there's no barriers to how this affects women in, you know, all levels of our society. And then lastly, I think as an organization, you know, if you have a lot of reach, then you use that opportunity to, you know, set some time aside, like you did in Tampa, like we're doing today, to talk about this. You know, if you have community meetings on a regular basis, that one of the community meetings is about breast cancer awareness, any type of awareness, prostate cancer, overall health awareness, just taking the opportunity when you have a large audience to spread the information so that people are aware. You know, no one has to be an expert on this but me. It just really takes a lot of, it just takes a little bit of time to give somebody just a little nugget of information that they can go back to their doctor and talk to about. They can go back to their family and talk about. You know, and the biggest thing that I like to say is that, yes, breast cancer is treatable and curable. And I think that for many women, if they feel something abnormal is going on, they are a little hesitant because they're like, you know, this is going to be bad. I don't want to even figure out what's going on because this is going to be bad. But the bottom line is, the sooner you figure out what's going on, the sooner you can take care of it, the sooner it can be something in the rearview mirror that you don't have to worry about anymore. So hopefully that answers your questions, and those are some good take-home points.
Those are excellent points for us all. And, you know, to use this opportunity to talk about. So Jaleesa, first of all, let me thank you for bringing Dr. Henry to us in this realm and in this particular opportunity to talk openly and honestly. I know as I was growing up in our home, you know, it was the cancer. You whispered it, you didn't speak it, you definitely didn't talk openly about the disease itself, or about the fact that there were ways by which one could be treated and it could be cured. And especially when you start talking about breast cancer, it was just a non-conversation starter. And so just to be able to have an open and honest conversation with a highly educated and informed medical physician who is also someone who looks like us is a wonderful, wonderful opportunity and experience, and hope that we can take this back to our families and to our coworkers. We're always talking about wellness and the need to better ourselves professionally, but I think we also have to better ourselves with information. So as supervisors and the roles that a lot of us find ourselves in, we can have these conversations with our employees, with those that are our team members, from a point of knowledge. And be able to direct them even to persons like Dr. Henry is a benefit and another piece in our toolbox as public administrators as well. I do want to say your husband is with us today. And Jaleesa said it yesterday, and I was like, wait, that's who she's married to? Oh, wow. So Jason, thank you for being with us today. And Jason Reynolds is the manager here in Orange County, with our code enforcement and neighborhood services and a whole lot of wonderful things that he is doing involved with bettering our community as well. So this is one of our Orange County power couples. I'll put it that way. And so
thank you so much. And
we're glad
I have to say, while we're on the topic, that, you know, I couldn't do what I do without his support, you know. And so thank you for having me, and thank you for having Jason too. His, you know, what you guys do is sometimes a thankless job, but so important to our community. So thank you everybody that's on the call for what you do as well.
So any final questions or thoughts for Dr. Henry? I don't want to keep her. I know she's got a full schedule today. We thank you so much. We will be back in touch with some thank yous. Let me ask you this. Where are you working? Because I did not, maybe I missed it. You're at Orlando Health, is that correct? And can
Yep.
we, if we have issues that come, or we are working with some of our employees, can we make that or give them your information for their physician to make a referral? Is that something that's
Yeah.
available to us?
Absolutely. Unfortunately, something happened with the graphics in my presentation today, but I do work for Orlando Health Cancer Institute, and it's under the Orlando Health umbrella. We have several facilities across Central Florida. I primarily work downtown at the main cancer center, and then I also have an office in Dr. Phillips at the Dr. Phillips Cancer Center. I will send my contact information to Jaleesa, and she can share that with everybody on the call. And I'm always happy to see patients with any issues related to the breast. So it's not only breast cancer, you know, if you have any breast issues, we take care of all of that here.
Awesome. Well, it's good to know that breast cancer, when I was coming up, folks saw it as a death sentence. And it is good to hear you changing that paradigm and changing that perspective on particularly breast cancer, but as we go through as cancer, the different cancers, and changing some of that mindset of, particularly people who look like us, and who have that fear of hearing that C word, and carrying that fear into how they then move forward with treatment or the lack thereof. So thank you so much for that. It is 12:55. I'm gonna ask Berenice if we, or Jaleesa, if you all have closing words. How did our poll come out? Do we have some direction for how we move forward in the coming months based on responses today?
I think that may be a question for Berenice. Berenice,
Okay.
do you have the summary of the
Do you
poll?
have a summary?
Yes, I do have the summary of the poll. So in regards to the results, the majority of people voted to have the meetings alternate each month. So one month being in person, one being online. So I guess that might be the way we'll be proceeding with future meetings.
Awesome. So it sounds like we've been given some direction for how we march forward into 2022 with some alternative opportunities of virtual versus in-person, and maybe even some hybrids with the in-person components. I know that we've had an initial conversation that our April meeting may very well be an in-person meeting, and maybe even an after work type of an event, so that we can do our installation of officers and have some time to just kind of fellowship together and build some of those professional networks in person, as opposed to what I call the Brady Bunch, stackable boxes and looking up and looking down and left and right, trying to see who's here. So we will be back in touch with that information. So watch your emails for the April meeting information. Know that it probably will not be a lunchtime event. So get your calendars ready for something in April that may be a little bit different than what we've seen in the last couple of years. And I think we'll be happy to have that opportunity to at least kind of wave at each other in a more personal environment than sometimes this virtual world we live in provides. Any closing remarks from any of the other members? I see some names and faces I'm not familiar with, so, or that were here. But I'm glad to have you all here. And I will share with our president that we have it all recorded so she can go back and watch, and I'm sure we'll have some comments and some information for us as we go forward. Any other comments?
Just a note that the recording will be available sometime tomorrow or Thursday on our chapter website. So be sure to visit our website as well as our social media pages that will link back to the recording and you can share with other people. We're so glad to have you guys today.
Well, on that note, I will say thank you and just note we're ending early today. And thank you all so much for your time and for your commitment again to NFBPA and the Mid-Florida chapter. And we look forward to working with all of you in the coming year. Thank you.
Good job, Julissa.